So that sounds pretty terrifying, the idea that obesity can increase your risk for Alzheimer's disease. And so in considering all of that, we wanted to then figure out what are some positive actions that individuals can take to reduce their risk. So if obesity can raise the risk for Alzheimer's disease, could physical activity reduce that risk? Could physical activity itself improve brain atrophy, preserve the brain, and actually give people larger gray matter volumes as they age instead of resulting in smaller ones? And so we tested that with looking at the behavior of walking. And the reason we looked at walking in our study is because walking is the simplest form of physical activity. One does not have to be a member of an elite gym or engage in a very complicated set of routines, and it's a very easy thing to track and measure in our study. So we investigated that, and we looked at this in a larger number of subjects. So the first study I talked about only looked at about 100 subjects. In this study, we looked at about 300 individuals, and these were all, again, cognitively normal individuals who did not have any memory loss symptoms, and we tracked their progress over time to see if they developed Alzheimer's disease and cognitive decline, and we also looked at their MRI scans with that same voxel-based techniques with the 3D pixels to determine if they had an increased risk. And we broke it up by looking at the quartiles or categories of physical activity. So in other words, we had categories for people who walked a lot, people who walked very little, and people who were somewhere in between. And in comparing that, we also looked at individuals who were cognitively impaired as well. So now we had an additional 130 subjects with either MCI, mild cognitive impairment, or Alzheimer's dementia, because we also wanted to see, could physical activity reduce the level of decline in people who were already diagnosed with the disease? The results were very powerful. What you're seeing here are images from our study published in Neurology in 2010, where we highlight in the 300 cognitively normal individuals these blobs. And before, when I showed these blobs, it was always bad. It was always brain atrophy, reduced brain volume. But here, these are areas of larger gray matter volume in individuals who are physically active. And the areas that benefit the most are areas that are also important in memory and learning. The prefrontal cortex, the temporal lobes, the hippocampus. And what was also very interesting about this study and very important is that these individuals, to attain this brain effect, only had to walk 1 mile a day in order to attain this. So about 6 miles for the entire week. And the individuals that I'm showing right here on this side, so this is a recap of the earlier slide, and this is individuals who are cognitively impaired. If they walked about 5 miles a week, so about 3/4 of a mile a day, they also had better brain volumes than their people with Alzheimer's disease who did not have this physical activity profile. And so physical activity improved brain structure in cognitively normal individuals, and if they could get the increased brain volume in the hippocampus with walking 1 mile a day, the risk for Alzheimer's disease 10 years later dropped by 50%. The individuals with Alzheimer's disease already diagnosed, their disease was not reversed. However, their cognitive decline was slow. Their performance on their memory tests did not decline as quickly as those individuals who were sedentary or not physically active. And we see this right here. This is showing a 1-point decline for individuals with Alzheimer's disease on the mini-mental who walked 5 miles per week over 5 years. So just 1-point decline. And the individuals who were sedentary, there was a 5-point decline, which on that test is a big jump. So what it suggests is that while physical activity can reduce the risk for Alzheimer's disease, it may also slow the decline in people who already have it, even though it can't actually reverse the effects.